Here we're looking at the dissection of a heart. This heart has been cut in a frontal or a coronal plane already. So what we're going to do is we're going to figure out where the four different chambers are to start with. In order to figure out the chambers, we have to look at the thickness of the ventricular wall. So looking at this portion right here, we can see how this ventricular wall is thinner than this one. That means the thinner wall is the right ventricle, the thicker wall is the left ventricle. So on this side, now we flipped it over, this side, this is the left ventricle, the smaller one is the right ventricle, it's kind of squished. So let's start with the right atrium. This is going to be the right atrium right up here. Now we can notice in the right atrium that we need to have two main vessels, the superior and inferior vena cava, feeding blood back in. So to look and see what we have here, we kind of move this a little bit. This vessel right there, you can see how it's coming into the right atrium. That's the superior vena cava. Now back here, there we go. This is the inferior vena cava. You see how it also comes in. Now as the blood flows into the right atrium, it needs to go through down to the right ventricle. This valve right here, this is the right atrioventricular valve, also known as the tricuspid valve. You can see then also the anchors, a little bit of these chordae tennae here. These white strings, these chordae tennae, are going down to a papillary muscle. You can really see a good example of a papillary muscle right here. So here again, chordae tennae, and this piece right here, this is a papillary muscle. So when we go down to the right ventricle, the right ventricle, when it contracts, will send blood up to your pulmonary trunk. It's heading to the lungs. On this dissection, it's over here. It's deep in the back, so you really can't even see where it comes out, but it's deep back there. So that's where the pulmonary trunk will be. It actually wrap all the way around and come up. So it's deep back here. So that means when the blood leaves, it's traveling through the pulmonary semilunar valve. When the blood comes back in, it has come back to the heart in the left atrium. So thicker wall means left side. This is your left atrium. The blood will come back into the left atrium via the right and left pulmonary veins. It can then come down and pass through this valve, which is known as the left atrioventricular valve, also known as the mitral valve, also known as the bicuspid valve. Again, anchored in place by these chordae tennae down to a papillary muscle. Once the blood enters into the left ventricle, which you can also see right here, it can then be pumped out through the aortic semilunar valve, which is right here. So this is your aortic semilunar valve heading up into the aorta. So that is the aorta right there. So we have the pulmonary and then the aorta. So this is the aortic semilunar going up into the aorta itself. Remember that the aorta is going to have several branches off of it. In the case of the human heart, the aorta has three branches, remember. We're going to have the brachiocephalic trunk, then we'll have an order of flow going into the left common carotid artery, and then the left subclavian artery. But those are not visible on this particular heart. So we're looking at, again, the dissection of the heart. Other structures of note, you have the interventricular septum right in the middle, separating the right and left ventricle. You're going to have the apex, which is this point at the bottom. The top of the heart, where the vessels are found, is referred to as the base. If we put this back together, you'll be able to notice we have these structures, these expansion flaps. There's one here and one here. Those are the auricles. So if we look down here, You can see that this is the auricle. Turn around. It is covering right over the atria. Other structures of note to look at, you can see in the atria up here and here. The muscles that line the inside of the atria are going to be the pectinate muscles. Down here, we can see the muscles that line the ventricle. Those are going to be the trabeculae carnae. Then we have the three layers of the heart. We're going to have the inside lining of the heart, which is the endocardium. We'll have the actual musculature, which is the myocardium. And then we have the outside layering, which is going to be the epicardium.